Good afternoon and welcome to Webinar Wednesday. Today we are joined by Mike Tohill, Senior Director of Customer Success at Cognosos. Webinar Wednesday would like to thank our sponsor Cognosos. Cognosos utilizes the power of AI to transform tracking data into operational intelligence, redefining the value of location solutions. They help hospitals reduce costs, optimize clean room operations, and improve staff safety with their RTLS and staff duress solutions. Cognosos is able to quickly deploy a system with room-level accuracy without room-level equipment that excels in complex environments, producing value from day one. So for more information, please visit cognosos.com. Now, just a quick reminder about our Spring MD Expo, which will be held at the Pechanga Resort Casino in Temecula, California in April. That's the 15th to the 17th. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. Again, for more information and registration details, please visit mdexposhow.com. We also have a milestone to celebrate here at TechNation. We turn 15 this year, and who better to celebrate with than our readers? TechNation invites readers old and new to help celebrate its anniversary with 15 prizes and a monthly time capsule in the magazine. So for more information and your chance to win, please visit onetechnation.com/contest. Okay, today's webinar is eligible as usual for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Okay, let's kick off today's webinar by giving away a Swiss Force Meister multi-tool. So using the questions feature on your dashboard, let me know the answer to the following trivia question. Today is National Pistachio Day. Which state produces the most pistachios? I'll reveal the answer and our winner at the end of the webinar. We'll be wrapping up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. Now, as I mentioned earlier, our presenter today is Mike Tohill. So Mike, you may begin whenever you're ready.
All right, thanks, Linda. Well, welcome everybody to today's presentation. For those of you that are overseas or on the West Coast, good morning, good afternoon, good evening. Excited to be here today to talk about the power of RTLS data. So before we get started, just a little bit about myself, my background. So as Linda mentioned, I'm Mike Tohill. I'm the Senior Director of Customer Success here at Cognosos. I've spent about 27 years in the healthcare IT industry. Most of that time, I've been working with or for RTLS companies like Cognosos. So a lot of people would say that I'm one of the RTLS lifers out there, but it's definitely a field that I'm very passionate about. Specifically at Cognosos, I'm focused on our solution delivery, managed services, and customer success management teams, and really focusing on the client relationships, delivering value and really helping our customers achieve their business objective. So with that said, let's go ahead and jump into today's presentation. All right, 1 second. All right, so the hidden power of RTLS data. So, most people, when they think about RTLS, the first thing that comes to mind is dots on a map. And you'll see down there at the bottom, RTLS really isn't just about dots on a map anymore. Obviously, a critical component to any RTLS asset management purchase. Where's my stuff? It's kind of the foundation of everything, but it's not the only thing anymore. And really, the true power of an RTLS asset management system is the data that's captured on the back end and the ability to leverage that data to make true data-driven decisions. So really what we're going to talk about today are a couple of main topics. And you'll see that I've got 3 of them highlighted here on the screen. And there's going to be a little bit of overlap as we kind of talk through these things. But really the first is, what kind of data is actually captured within your RTLS system? You'd be surprised, a lot of people don't realize the type of data that they have access to as part of their RTLS system, whether that's native location data as part of the system or things that are coming in from external systems that are aggregated on the back end. So we'll talk a little bit about that at a high level. And then we're going to spend some time really talking about how do you make use of this data that you've captured. Again, there's a lot of data there that can really help drive business decisions, ultimately save the organization money, potentially drive some operational change, etc. So we'll talk a little bit about the types of data that's there. We'll talk about some real life examples from my experience in working with and for other RTLS companies. And then we'll take a quick look at some of the reports and dashboards that are actually available in our system that our customers are leveraging to do some of that work. And then kind of the last thing we'll touch on, which is really kind of an extenuation of the second bullet there, is what are some of the patterns and trends that are available within the system that can really provide some insight into your operations? So looking at process bottlenecks, staffing decisions or potential augmentation, some things of that nature. So really kind of looking at the data within the data itself. So again, we'll talk about all three of these, and there'll be a lot of overlap, but we'll definitely hit on each one of these topics. All right, so what type of data is captured within your RTLS? And this is really about understanding the breadth of RTLS data that is available to you. I've got a pretty simplistic graphic here. I was thinking about this a lot this week, and I really wanted to make this as simple as possible. For those of you that have been working with RTLS systems, or maybe in the process of evaluating RTLS systems for your asset management needs, you've probably seen some version of an RTLS pyramid. We all have them. I've worked for several RTLS companies, and everybody has a version of an RTLS pyramid that builds from the bottom to the top. And so there's a lot of value in exploring those different levels, but for today's purposes, I really wanted to simplify things. And so as I was thinking about it, I was thinking more about kind of a funnel approach. And in my mind, there's really two major groupings of data that make up your RTLS system and really give you the data that you can take and make those data-driven decisions. And so as I was putting the presentation together, it really comes down to the asset data, and it comes down to our RTLS data. And so when we're talking about asset data, that can be a pretty broad categorization of data, but really what we're talking about here are asset types that you're going to capture in your system, the type of equipment that you're going to tag, any of those details that are important to you about the specific assets, be it model numbers and serial numbers, preventative maintenance dates, which we'll talk about a little bit, any rental information. So many organizations are renting equipment, capturing those rental dates are pretty important. So again, any of those really critical data elements that would be tied to an asset are things that are going to be part of the data that you're going to have available to you. And then again, the other major category of data that you're going to have is the RTLS data. So any of the data that is inclusive of locations and tags and where something is and where it's been, where it shouldn't be, which we'll talk a little bit about. Is it being utilized? Is it being underutilized? So any of that data that's being captured behind the scenes that really is driven by the RTLS system itself. So again, there's other data that we could talk about. There's other pieces that are coming in and out, but it really, in my mind, it comes down to these two major groupings of data. And so, once you kind of understand, again, the major categorizations of data that is available to you, it really comes down to, okay, I got this data, I know what it is, how am I going to leverage it to make data-driven decisions for my organization? This is all great, this is all well and good, but how do I use this data to help me organizationally? And so what we try and typically do during a kind of the contracting, the pre-sale phase, or even during the pre-implementation phase, is really work with customers on identifying the problems that they want to solve. And this will be varied from organization to organization. But from my experience and what I've seen at Cognosos with the customers we've worked with, it typically comes down to, these 5 kind of major areas of focus, these 5 major problem areas. And so, one of the things we like to do is work with customers and say, okay, what are your problem areas? What are those KPIs that you want to address as part of your RTLS deployment? And kind of get into the details of what exactly is the problem area. So again, if you're looking at something like equipment utilization, do I have the right amount of inventory to support my equipment distribution needs? Am I able to do data-driven par leveling? Can I implement processes that impact the equipment utilization that I have? So really looking at how you can solve some of the equipment utilization through the data that you're capturing. Overspending on rentals and capital purchases. This is obviously a huge one. Anywhere where you can make potential cost savings is hugely important for a hospital organization. So again, right sizing your inventory. Do I have the right allocation of equipment? Do I have too much? Do I have too little? And am I renting too much? You'd be surprised at how many organizations are renting equipment that they don't even realize they're renting. They either think it's lost, they can't find it, they've forgotten that they're renting it, and they're just paying month over month for something that they may not even be using. Device shrinkage. I'm losing equipment. I know I'm losing equipment. I don't know how I'm losing equipment. I don't know where I'm losing equipment, and I don't know how to keep it from leaving the facility. Big problem. This is something we see all the time. And there's a lot of data that can be captured on the back end that can really help identify where that equipment loss is occurring and ways to prevent it. Wasted productivity. This is a huge one. And this isn't just for clinicians, but clinicians should be providing clinical care, not looking for equipment. The last thing you want is for your nursing staff or other clinical team members roaming around the floors, trying to find equipment, calling down to central processing, looking for equipment, and not caring for patients. Total productivity waste. And that applies to other areas too, but typically what we see is this is primarily a focus on nursing staff. And then regulatory compliance. And this will vary from organization to organization, but there's typically some problem to solve in terms of regulatory compliance, whether it's process management, change management, something to that effect. But again, these are kind of those 5 major areas that most organizations think about in terms of problem areas when they're looking to implement an RTLS asset management solution. And so once you've kind of identified the problems, the next question is really, what are your performance goals? You're going to implement this RTLS solution. You've identified your problem areas. What do you want to try and achieve in terms of performance? Again, what is going to be your ROI here? How do you want to save money or decrease utilization, increase utilization? So again, what we're looking at here is something that we present to our customers, again, kind of during that pre-implementation phase. There's kind of a benchmark or a guide for them to start thinking about what are those performance goals that we can potentially achieve as part of our RTLS deployment. And again, how am I going to use the data to actually hit these goals? So again, not an exhaustive list. These are not set in stone, and these will obviously vary from organization to organization. But what we typically present to customers and what we've seen customers achieve is, 1, looking at a 15% increase in equipment utilization. And again, as you're implementing your RTLS solution, you're identifying where all your equipment is, you're tagging everything, you'd be surprised at how much equipment is actually there that you didn't know existed. So looking at ways to increase equipment utilization. Reduction in rentals. So we typically see, or on average, average that organizations can get about a 25% reduction in equipment rentals. Again, as you're identifying equipment that you own, as you're identifying equipment that you've rented that you may not even know you're still renting, there's a pretty easy way to get to that 25% reduction in rental equipment. Reduction in lost, stolen, misplaced equipment. We typically see a higher number than 50%, but 50% is kind of a benchmark. So again, as we're working through the process of implementing an RTLS solution, as you're learning how to use the solution, identifying those places where equipment goes, where it shouldn't go, making sure that staff know if it goes to a certain location, they need to address it. And we'll talk a little bit about some of that when we get to the data part. And then ultimately, you really want to shoot for 100% availability of clean equipment. If you've got this fleet of equipment, you've spent a tremendous amount of money on it, you've identified it all, you've tagged it, you need to make sure it's available. So making sure that you have processes in place, be that through your clean and dirty sterilization process, through your par leveling process on the floors, it really is critically important to have that 100% availability of clean equipment for caregivers. And again, we'll dive into some of the data and metrics here as we get into kind of some of the next sections. So again, now as we think about some of the areas we've talked about, so identifying those problem areas, so those 4 or 5 key areas that we talked about on the previous slide. Now you're thinking about performance improvement goals. So how am I going to address, or what are my metrics going to be to address those problem areas based on the data that I'm now going to have available to me? And so now we're kind of into the data-driven decisions. So identify my problems, I know what my metrics are, got all this amazing data that I've captured over time. What do I do with it? How does it help me achieve my goals? And so again, we'll look back at those 4 or 5 key areas that we've talked about in terms of problem areas and metrics, and really start to look at some examples of what customers have been able to achieve, and some sample reports for what's available in the system. So the first thing that I wanted to talk a little bit about is proper equipment utilization. So again, we're talking about wasted productivity, having caregivers constantly rounding the floors, calling folks, trying to find equipment is just a complete waste of productivity when time should be spent working with caregivers. And so one of the real-time dashboards that's available within our system, we call it ProPar, basically par leveling screen, is really looking at the amount of equipment you have, and we'll use IV pumps as an example. So kind of right sizing your IV pump inventory, looking at what your historical needs are on a floor or in a unit, and then setting the appropriate par levels within those clean and dirty cores. And so as you implement that solution and you look at it over time, you can make those real-time adjustments to say, you know what, on this particular floor or in this particular unit, we thought we needed X amount of equipment and we really need Y. It's 2 less than what we thought because we're getting things through much quicker. So you can really try to right size even the equipment needs in a particular floor or a particular unit just by using the historical data that you're able to capture within the system. And so there's a lot of power in that. One, again, you're looking at equipment purchases and rentals. I probably have more than I need. Now that we've optimized our clean and dirty process, now that we've optimized our utilization, we can look at actual true cost savings in terms of purchases and rentals. So again, implementing those processes, looking at historical data is critically important when you're leveraging your RTLS system. All right, data-backed purchasing and equipment rentals. So a couple things here that I think are pretty interesting. So again, it's all about cost savings. Hospitals are always strapped for cash, and we all know that. So there's a lot of power in being able to reduce costs. So kind of in the top right here, just wanted to highlight an experience that I had with a customer in my past that purchased an RTLS system. It had the system in place for maybe 6 months or a year, and was looking to make a pretty substantial capital purchase of IV pumps. And so, it was around a $15 million potential purchase, obviously a big spend for the organization. And as they started to look into their RTLS system, understanding where their equipment was, what their utilization was, they were actually able to reduce that capital expenditure by about $5 million because they had more inventory than they realized. And so not only did we save them money on that capital purchase, that savings also went towards helping pay for the RTLS system that they had already invested in. So it was really a major win-win for the organization on that front. I can tell you there's some other customers that we're working with right now that are looking to make some similar purchases of equipment. And so we're working with them to make sure that as they're implementing their RTLS solution and as they're looking at making some of those capital purchases, they're really taking a hard look at the data within the RTLS to make sure that those are justified purchases. Kind of coupled with that is equipment rentals. So, obviously within your materials management systems, a lot of organizations have the ability to track equipment rental information. What I've observed in my experience in the industry is it's not always captured as cleanly as one would think. And so we have the ability within our systems to actually pull in rental data from other third-party systems. And so what you can see here on the screen, kind of on the bottom right, is one of our reports that you can pull up. It's a real-time report that will basically show you asset information, rental due dates, and location. So you can actually have notifications that come out or reports that are spit out to your RTLS administrator or whoever manages your system in advance of rental due dates, so that hey, in March, I've got 16 IV pumps that are up for renewal or return. And so you can easily find them, and then you can make that decision. Do I still need them or do I turn them in? It's pretty surprising, again, in what I've observed, that a lot of organizations don't know what rentals they have, either because they didn't really have good paperwork, or they thought they'd lost the equipment and forgot to cancel the rental contract, or they've turned it in and perhaps the rental company was still invoicing them by accident. So again, there's a lot of power in knowing what rentals you actually have, where they are, and what those due dates are. Again, a real big potential cost savings there. Attrition, equipment attrition. So preventable loss, shrinkage. People lose equipment all the time. Hospitals are massive. There's plenty of places for equipment to get lost within the organization and leaving the organization. So really being able to identify locations where you are losing equipment is a huge cost savings, again, for the organization. So again, I've got kind of 2 examples on the screen here. These are actually from 2 different customers. So we had one customer, that metric kind of on the top right there, that actually over the course of, I think it was the first year, was able to reduce their equipment loss by 92% after implementing the RTLS solution. That's a hugely impactful number for an organization. Being able to do a 92% reduction simply by knowing where your equipment is and where it's going or shouldn't be going is extremely powerful. And so kind of coupled with that, on the bottom there is just a report from a different customer that kind of highlights the data that you can get out of the system in terms of those, I guess I would say, locations where equipment shouldn't go. So we call these egress points, exit monitor locations, so you can identify those within your organization. But at this particular facility, you can kind of see over the course of a couple of days, they had some infusion pumps that went down to the loading dock. They had one that ended up in the laundry. a couple that were at various emergency department locations, ambulance entrance, and the exit vestibule. And so they were able to, in real time, keep this equipment from leaving the facility. They were able to get to it before it left. And so again, huge cost savings, because we literally had 6 pumps that may have left the organization and never returned. So again, having that ability to identify those locations where equipment should not go, and to be able to alert staff in advance is extremely powerful. And then kind of another thing I wanted to highlight here is, around scheduled preventative maintenance. Again, a lot of CMMS materials management systems are able to capture this kind of data, similar report to what we looked at with the rental data. But again, having that all available in one system to drive reporting is pretty powerful. So again, just a sample report from one of our customers where you can see there they had some SCD pumps. They've got some PM preventative maintenance coming up actually later this week. And so can easily make sure that that equipment gets brought into clinical engineering to get preventative maintenance taken care of. So again, knowing where that equipment is, knowing when the preventative maintenance dates are coming up, again, extremely powerful information to have. And again, these are just a couple of examples from existing customers that I pulled out. There's lots of other potential reporting that is available within the system to help drive some of that decision making, but these are definitely some of the bigger ones that our customers are leveraging for, again, cost savings, decision making, kind of operational change. And then one other thing, I wanted to touch on, and this again kind of goes into the data category is, so what are those kind of hidden patterns and trends that you can kind of look at to help gain insight into operations? And these are things that typically, you would notice over time. So maybe not right out of the gate, but as you continue to aggregate data over time, you can kind of start to look at patterns and trends of what's going on within your organization. And so there were 2 in particular that I thought were pretty compelling from customers that we have that really showed the power of some of the data that's there. The first one is just around staffing patterns. So particularly in biomed or clinical engineering, there's a lot of equipment that goes in and out of that organization in terms of repairs and central processing for cleaning and making sure clean equipment gets back out on the floor. So there's a lot of responsibility for the equipment going through the biomed organization. And so what we observed at one of our customers, this was pretty interesting, was in terms of staffing patterns. And so what you're seeing here is a report that we generated out of our system that shows the average hours equipment spent in biomed. This report was week over week. You can drill in and do day over day and things of that nature, but you can really trend it in this example and see that there were a couple of weeks in particular where equipment was spending an exorbitant amount of time in biomed, which means it's not out on the floor available for clinical care. And so as the customer was looking at this data, looking at the trends and kind of drilled into that particular week, I think it's August 18th there, you can really start to look at what's going on. And so do you have individuals that are out sick and you don't really have a backup plan? Do you have a particular day of the week or particular shift during a day of the week where maybe you don't have enough clinical engineering staff on hand to handle the equipment needs? I believe in this particular example, a lot of the bottleneck was occurring on Sunday evenings into Monday morning. Simply not enough clinical engineering staff on Sundays and Monday mornings to get the equipment turned around in time for kind of the Monday morning rush. So the organization was able to make some adjustments, shift some staff around, and really bring those numbers back down into the range where they felt they were acceptable. So again, looking at that trending, looking at the patterns, looking where you can make adjustments and changes is pretty important. You could also look at this seasonality. You could look at seasonality. So, peak holiday season, peak flu season, again, you can kind of look at where the trends are and look at where you might need to make some staff augmentation. Process breaks. So this was another pretty interesting one. This was an implementation. This was early on in the RTLS implementation. The organization had kind of rolled out a new clean and dirty process where everything was required to go through basically from patient room to the dirty core to central processing for cleaning, back to the clean core, and then back into circulation for patient care. So during the infancy of the project, the customer was able to look at basically where do we have equipment, and again, in this example, I think we were looking at IV pumps. Where do we have equipment within the organization that is falling outside the process? So process breaks or non-compliance. And so we were able to break it down by floor and by unit to really look at, in the ICU, we had 40 pumps, and I believe this was over the course of a day, that didn't go through the proper process. They didn't go from patient room, dirty core, central processing, back to the clean core, and then ultimately back into patient care. And so you're able to look at this and figure out, what's going on here. Do we have maybe new staff that haven't been trained properly? Is there some confusion around the new policies? Do we have too much equipment or not enough equipment on the floor, and so caregivers felt like they couldn't afford to send it through the process? So you're able to look at the data and kind of dig into what is causing the process break. What was particularly interesting about one of these, as we dug into some of the data, we found that there was one particular pump, and if you look at the top right there, it's a little hard to read, but there was a particular pump that we were able to basically track from patient room to another patient room 9 consecutive times without actually going through the cleaning process. So it went from, patient room A to B to C, back to A, so on and so forth, before it actually went through the proper cleaning process. And so you can really start to dig into that and figure out, why do we have non-compliance? Again, is it an education problem? Is it a trust issue? Do we not have trust in the process? What is causing that behavior, and how do we address it so that A, we have proper equipment for clinical care, and B, that things are being cleaned properly. That was another thing that you can kind of take from this is looking at HAI rates at a particular hospital. If you've got equipment that's not going through the proper cleaning process and your HAI rates are high, you can start to make some correlations in terms of what may or may not be going on there. So this was a pretty interesting use case. Again, just being able to look at that data and see where a piece of equipment went from room to room without actually going through the valid clean process. So again, as you accumulate more data in your RTLS system, as the system runs for more time, as you begin to get more comfortable with the data that's there, you can really start to look at those patterns and trends that, again, can help with cost savings, with process change, compliance issues, again, infection prevention, so things of that nature. So really leveraging that data to make some powerful business decisions for your organization. All right. So with that said, Linda, I'm going to turn it back over to you for any questions from the group.
Perfect. Thanks, Mike. Yeah, we've got a few that have come in. The first one is, how are the benefits of an RTLS asset management system typically quantified?
That's a great question. One of the things that we do, and I touched on it a little bit when we were talking about, identifying your problem areas and your metrics, is as we're working through that contracting process or the potential contracting process with the customer, is really doing an ROI analysis. We are very much a proponent of providing an ROI analysis upfront for a customer. There really has to be a true benefit to invest in an RTLS system. So we'll look at, all kinds of information that's provided by the organization, equipment inventory, size of facility, things of that nature, and really help the customer understand what their potential long-term ROI is over time. And we typically do that over a 5-year period. But really, again, the benefit, the power to us is the benefit to the organization. If we're not providing value to the organization, if the organization is not getting cost savings or process improvement, if they're not driving ROI, there's not really value in investing in the system. So we really do that ROI analysis up front with the customer to identify that.
Okay, so how has leadership integrated the new analytics into everyday operations?
How does leadership integrate with the new system? Is that kind of what you said?
Mm-hmm.
Yeah. So one of the things that we push very hard on an implementation is leadership buy-in. The minute that we start to engage with an organization on a potential implementation, we identify key stakeholders up front. In my experience, if you don't have strong buy-in from your nursing leaders and your biomed leaders and your finance leaders, clinical leaders, EVS, all those major players, your system won't be successful. So there really is a conversation up front about leadership buy-in, identification of key stakeholders within each of those groups that will be part of a governance committee that meets throughout the course of the project that will have input into not only the implementation, but excuse me, the long-term operational management of the system. And so we really emphasize that leadership engagement from the beginning of the project.
Okay, so how much time should elapse before you start leveraging the data to drive decision making?
That's a good question. It's a little bit varied. As I was talking about, some of the data that you're capturing, you can really start to leverage out of the gate. So as you're right sizing your inventory, as you're identifying all of that equipment that you have on hand that maybe you didn't know you had on hand because things are coming out of the woodwork as you're tagging equipment, you can really start to make some purchasing decisions and potential reductions in rentals. One of our recent customers, we kind of went through that. It was a fairly large organization. We had a number, again, I'll use the IV pumps as an example. They had a number that they thought they had in terms of purchases and rentals. And as we went through the entirety of the deployment, we found that number those numbers weren't exactly what they thought they had. So they had, more rentals than they thought. They had less purchased equipment than they thought. So you can really start to take real life data to kind of make purchasing and rental decisions. So in that instance, it doesn't take long. Within 30 days, you kind of know what your inventory is. Some of the longer term things that we talked about with the trending and the patterns, looking at some of the process breaks, some of the potential staffing augmentation, typically I would say 30 to 90 days, you can start to aggregate some of those trends and really look at what's going on in some of those key processes. So I guess long story short, there's not an exact answer. It's kind of variable based on the type of decision making you want to do. Again, some of it you can do right out of the gate, and some of it takes a little bit of time as you aggregate that data.
Okay, another one that's come in. What would you say is the most critical data elements to capture?
Kind of again, going back to the last point, I think making sure up front that you have identified all of the equipment, both purchased and rentals, out of the gate, making sure that your inventory is accurately captured. If you don't know what you have, if you don't know what you're renting, it's very difficult to make purchasing decisions. It's very difficult to do cost savings based on a guess. So again, I think the most critical data element is right sizing the inventory, confirming what you have, understanding where it is, locationally within your organization. Then you can really start to drive, those cost savings, rental reductions, and then really start to look at, some of that other data around preventable loss. So again, once you know what you have and where it is, you can figure out where it shouldn't be, and you can kind of identify how you can keep things from leaving the organization. So, I would say kind of that key piece is really the right sizing and the inventory control at the beginning.
Okay, we've got a question about equipment utilization tracking. Okay, if it's overused or underused, how can it help in future purchase planning?
That's a good question. So, and we get asked this often. I think there's a couple ways. So I'll tell you how we're looking at that data today, and potentially some of the things we were thinking about. So in a typical RTLS deployment, in terms of utilization, and again, I'll use an IV pump as an example. If a pump is in a room, you can make some assumptions that it's being utilized. Again, if you have an implemented process, where equipment should go from patient room to dirty core to central processing to clean core back to patient room, you can kind of make an assumption, again, I'm saying assumption here, that equipment in room is utilized. Now, if you've got a lot of process breaks, if people are, again, moving things from patient room to patient room without going through central processing, you could have equipment that's in a room not really being utilized. So it's a little challenging. One of the things that we've talked to some of the IV pump partners about is potentially doing integrations with the pump manufacturers where you can actually capture some of the infusing data. So as the pump is infusing, we know it's in the room. If it's in the room and it's infusing, it's being utilized. If it's in the room and it's not infusing, probably not being utilized. Somebody probably needs to take that through the central processing process. So again, right now, with just a base RTLS deployment, you can kind of make some assumptions based on in-room and not in-room. But as you look at more advanced integrations, you can pull in more data from some of the pump manufacturers to look at that true utilization data.
Great. So another question here is, how can RTLS help supply chain managers do their business?
Ooh, that's a good one. Again, I think having the ability to have all of the data in one place, again, as we talked about at the beginning, the asset data, the RTLS data, not having to bounce between a materials management system and the RTLS system, having it available in one place makes kind of pulling the data a little more easy. So the ability to have all that, as I mentioned, various details of an asset in your RTLS system with a lot of that information can make that a little easier. But I don't know, that's actually a good question. I probably want to think about that one a little bit more and come back to that one. But I think there's definitely some value that can be provided to the supply chain folks.
Okay, another one here is, how can AI help if implemented into RTLS?
That's an excellent question. So for those that don't know, Cognosos uses AI as part of its RTLS deployment. And I know AI is obviously a big buzzword right now. Everything's AI driven. So I think what's fascinating about Cognosos, and again, I've worked for some other RTLS companies in the past, and everybody does something a little bit different, is that Cognosos leverages AI on the back end to really make changes over time. So as the environment changes, as more equipment gets deployed, it's almost like a self-learning environment that can kind of improve over time. So that is the one interesting thing about Cognosos is the ability to leverage machine learning and AI to really improve the accuracy of the RTLS deployment as more data gets fed into the system and it's able to kind of look at things over time. So it's pretty powerful. And like I said, not something that a lot of other companies offer today.
Okay, so before we wrap up, Mike, is there anything else you should consider when investing in RTLS?
So, I mean, I would say, one thing you should consider, and again, there's a lot of different RTLS vendors. Everybody does, something a little bit different, is think about, again, the problem that you're trying to solve. If you're, and I'm not talking about just within the asset management space, but even long term, if you want to start with asset management, but over time you have an issue with staff safety and you want to implement a duress solution, or you've got a hand hygiene compliance issue and you want to do hand hygiene, really think about your roadmap, your 3 to 5 year roadmap in terms of what you want to implement. And I think that really helps drive the type of solution that you choose. So don't just think about the now, kind of think about what you're looking to accomplish in that 3 to 5 year window.
Perfect. Well, thank you so much, Mike, for a great presentation. If anybody's got any more questions, please reach out to Mike. His email is on the screen. So I'd also like to encourage everyone to visit Cognosos' website to learn more about the service they provide to our industry. So please visit cognosos.com. Now, as promised, the answer to today's trivia question is California. So congratulations to our winner, Andrew Warren. Just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Now, if you've missed any of our past webinars, including any by Cognosos, please visit webinarwednesday.live to view our whole webinar archive. We'll be back next week with another webinar, so visit webinarwednesday.live for more details and complimentary registration. So thank you once again for your time today, and I hope you enjoy the rest of your day.